Hi, I'm Wendy Roberts. I'm a developmental pediatrician. I worked for a long time at the Child Development Centre at the Hospital for Sick Children and led it for 10 years up to, I guess, 2007, and then was at Holland Bloorview for a number of years. And after that, a group of us decided that we would really like to model a centre for individuals with autism, and we were interested in babies all the way up to young adults, and so we started out and set up ISAND as a not-for-profit, and have been working on looking at how to provide that continuum of care for little ones and school-age ones and teenagers and then young adults. I see children at all ages, and as the children that I used to follow right from babies on have got older and older, I'm now seeing a lot of young adults who I remember well from when they were little, and it's just been amazing to see what little ones that we've worked with and worked with families eventually turn out like as they're becoming teenagers and then get into adulthood. Some of them into employment, some of them into day programs, a whole variety of activities, and we need a whole lot more of those activities in order to make sure that everybody has a place where they feel part of a community. Our goal setting out with ISAND, establishing a not-for-profit, but having to charge for services until we were able to do more fundraising and be able to cover our expenses. We have now got to the point where we're able to offer some scholarships to some families who simply can't pay, and I wish we could do a whole lot more of that, and that's our goal in our fundraising endeavors. We're very excited with our little babies to be able to recognize the signs of autism starting very early on, as early as 9 months. And we now have some of the kind of interventions that I think are working better than anything we've ever had before. They're behaviorally based interventions, but they're set in a natural environment, play and social interactions, working with parents. We do a lot of parent coaching, and then getting into our early intervention program, which is based on developmental and behavioral principles, but done within a natural environment. So we have a lot of fun at work, and our therapists do an incredible job in interacting with parents. And those same naturalistic interventions continue right on into school age, when kids are learning to connect with each other, learn how to make friends, learn how to think socially, so that they can understand how other people are thinking, and that's so essential in order to make friends. And then looking at what teenagers need, much of the same kind of social thinking and feeling how it is to interact with others. And then looking forward from high school to either university or college and into employment situations. It just goes on and on. So within ISAND, we are aimed to continue the care all the way through the growing up period and into adulthood. And we have clinicians who can cover all the various needs that families may have. So it's really, our goal is to have one-stop shopping, and parents tell us that it's wonderful to be able to keep coming back to the same place, even though they may not need a lot for a year or two, then something else comes up and then they know they can come back, and ISAND will be here and will have the clinicians to help them, or if absolutely not, then able to help them understand who they need and connect up in their communities, because some come from quite a long way away, and then be able to get the help they need to keep going. I think I've been very lucky throughout my career to really enjoy what I do, and I think the enjoyment comes both from interacting with little babies, interacting with cute little toddlers, interacting with children at all different stages and all different levels of functioning, and I think the enjoyment extends to working with families, because the families of young people with autism go through so much, but learn over time to really appreciate their young people even though sometimes that's with a great deal of frustration, a huge amount of expense, and really living with very few resources, lots of worry about what the other children in the family are going through because of their sibling with autism. Extended family gets very involved, and we get to know many of them as well, bringing the kids for therapy or coming in to help out with appointments. So it's really a whole family affair, and it's very, very enjoyable to watch and see what works and problem solve around what doesn't work. And that's what leads to a huge amount of enjoyment for all of the staff that I see here in working with children and families.